So, coming to how we can treat the different forms of patients, patient A and patient B. Our acharyas ages earlier knew that there is going to be a generation which is going to come who will not be able to analyze doshas and they need ready-made medicines. So in Falashruti they have given ready-made medicines such as Musili Kadiradi Kashayam and Pushanugu Churnam, etc. So no matter in which leucorrhea patient comes, if you give Musili Kadiradi Kashayam, the patient will definitely get result. If you give the patient Pushanugu Churnam, patient will definitely get result. If you give the patient Gulichi Sattva, the patient will definitely get result, but the result will be temporary or the result will be permanent. It is a different thing. For example, if you give the same Musli Kadiradi Kashayam, Pushanugu Churnam, etc. to Pitta Vata patient, to patient having Shaya, something which is in Kashaya format or Churna format will not relieve the Shaya. It will only give temporary result. But this same medicines when given in Kapha Pitta condition will definitely give for a long standing time, will definitely give good curable result. So how to cure Pitta Vata patient? Patient who is having Pitta Vata has the predominance of Ushna Guna and Ruksha Guna, heat and dryness. So how to relieve Ushna Guna and Snigdha Guna? You have to substitute it with Shita Guna and Snigdha Guna. Now, tackling or countering Ushna Guna and Ruksha Guna with Shita Guna and Snigdha Guna is very easy, but there is only one problem. The patient should not have ama or ajirna. If the patient has ajirna, then you cannot give Shita Snigdha to the patient, the condition will worsen. So, if the patient is not having any ama, if the patient is not having ajirna, then you can go for Shita Snigdha Guru Dravyas like Shatavari Legyam. It is excellent in reducing leucorrhea. Shatavari Legyam, Kushmanda Legyam, which is Shita Snigdha. Maha Tikta Gridam. Tikta reduces Pitta, Grita reduces Vata, Pitta Vata reducing. Praval Basmam, Shita Snigdham. All these medicines which is of Lekhya nature, Grita nature, etc. should be chosen to reduce the Shaya of the patient, thereby permanently curing patient. For example, prescription can be like this. Musili Kadiradi Kashaya, Pushanugu Churnam, and then add Shatavari Legium to it to get the permanent result. So that will be very much appreciated. But if the patient has Anagni or Ama or Ajirna, then you have to choose which is medicine which is both Agni Deepana in nature, at the same time reducing the Paitika Ama, at the same time giving Bala to the patient. So preferable Kashayas are Gulichadi Kashayam, Bala Gulichadi Kashayam. These Kashayams, Gulichadi, especially Gulichadi and Bala Gulichadi, they reduce the Shaya of the patient too, and then they reduce the Pitta also, and then they reduce the Shaya also to the little bit. So after giving Gulichadi, Bala Gulichadi Kashayam for a particular time, when the patient's Agni gets improved, say in the second week or third week, then you can shift to Lekhya or Grita. You can choose Shatavari Legium, Kushmanda Legium. N number of legiums are there. Ashwagandha Legium and Chavana Prasham, etc. Any kind of Balya Dravyas to the patient, depending on the condition of the patient. After giving Gulichadi and Bala Gulichadi Kashayam, then increasing their Agni will be preferable. Then there is a syrup in Himalaya called Leucol. Leucol contains nothing but Shatavari, Punarnava and Dataki Pushpa in a sugar syrup. So something which contains the main ingredient like Shatavari, which is Madhura Snigdha, in a sugar syrup format definitely reduces Pitta Vata. So I use Leucol syrup big time in Pitta Vata cases, not in Kapha Pitta cases. Kapha Pitta cases also it gives result, but there are some other very good medicines to be preferred in Kapha Pitta cases. For example, Leucol tablet will work because it is in Kashaya, just Churna form, it is Guliga form. Leucol tablet will work in Kapha Pitta conditions, and Leucol syrup will work in Pitta Vata conditions. Leucol syrup is Madhura Rasas, Shita Snigdha, etc. So that is how even in the pattern medicine you should be able to find the doshas where in the doshas to the patients where it should be prescribed. I am not only telling Leucol, any kind of syrup, any kind of companies, any pattern syrup should be analyzed with the doshas and give. Just because I give Leucol, you should not choose so. And in Pitta Vata cases, when having not having Ajirna, I also choose Madhifala Rasayanam. Madhifala Rasayanam causes Deepana Pachana and then it causes Rasadhatu Vriddhi too. That can be also the medicine of choice depending upon the condition. So coming to Kapha Pitta condition, so Kapha Pitta is Ushna and Snigdha. The medicine that has to be chosen opposite to it is Shita and Ruksha. Then you can choose all the Kashaya Dravyas, which is Tikta Dravyas. They are all Shita and Ruksha. All this can be chosen. And you can choose some Stambhana Dravyas like Pushanuga Churnam. That is main kind of prescription in Kapha Pitta condition. You can choose Musalika Adiradi Kashayam, that is where Kapha Pitta condition is proper indication of Musalika Adiradi Kashayam. You can also choose Arishta and Asava because the Agni is less. Choosing Arishta and Asava in Kapha Pitta condition gives a better edge. The famous Asava that is chosen, I choose always Lodra Asavam, that is very good. You can choose Asoka Arishtam, you can choose Chandana Asavam, you can choose Saribadi Asavam. Depending on the condition, you can use any amount, any kind of Asava that fits the particular patient. So preferably Kashayam, Arishtam, Guggulu, powder, Sattva, etc. can be chosen. We can also choose Kaishara Guggulu in this condition and Guluchi Sattva in this condition. Kaishara Guggulu can be chosen whenever there is a white discharge associated with back pain, etc. In particular cases, you can choose Kaishara Guggulu. And there is severe Pitta, you can choose Guluchi Sattva. And all other pattern, I think most of the patent that can be given and only comes under Kapha Pitta condition, not under Pitta Vata condition. So we have to be able to genuinely differentiate the patient belongs to which particular sect of group and then thereby prescribing medicines.